Hi everyone, thanks for tuning in to our presentation on menopause and osteoporosis. Your presenters are Kelly Carucci, Molly Csere, and Angela Sue. Our video is split into 4 sections. This is Angela, and I will be giving an overview of menopause. Molly will provide background in osteoporosis, Kelly will talk about osteoporosis screening options, and lastly, we will talk about lifestyle changes to protect against osteoporosis. Alright, so in this first section, I will be discussing the main principles of menopause and the general cycle for women. Menstrual cycles and menstruation both occur monthly. The menstrual cycle is a hormonal cycle that prepares for pregnancy and during which the uterus lining builds up. A menstrual cycle starts on the first day of menstruation, also known as one's period. Menstruation occurs when a female is not pregnant. As a result, estrogen and progesterone levels drop, and menstruation or bleeding occurs. No menstruation occurs when the individual is pregnant. The menstrual cycle changes with age. It generally starts at the beginning of puberty around 8 to 15 years old. The cycle length is longer in the first few years and becomes regular in one's 20 to 30s. Periods are often heavier in teens, then lighter in 20 to 30-year-olds. Perimenopause, or around menopause, starts when cycle length becomes irregular until eventually the cycle stops around one's 40s, 50s during menopause. The average age that menopause happens in the United States is 51 years old. Estrogen levels also change over time. The levels fluctuate throughout the menstrual cycle, but overall, they stay relatively constant until levels decrease around menopause. Some more about menopause. Menopause is a natural biological process that marks the end of a female's reproductive years. It is diagnosed after 12 months without a period and is characterized by irregular periods, as we mentioned in the previous slide, hot flashes, chills, sleep problems, mood changes, weight gain and slowed metabolism, and thinning hair and dry skin, among other symptoms. In addition, estrogen levels do drop. The estrogen that we keep talking about refers to a group of hormones mostly made by the ovaries in females. These hormones affect sexual and reproductive development, skin, hair, breasts, bone health, and more. While our presentation will focus on estrogen and menopause in females, it is important to note that males also have estrogen levels.
Switching gears now, let's discuss osteoporosis. This is Molly talking, by the way. What is osteoporosis? As you can see in the picture on this slide, osteoporosis is a disease that affects bones, making them more brittle and easily broken. On the left side, we can see a microscope image of what normal bone looks like. Compare this to the image on the right of osteoporotic bone. Osteoporosis is the most common bone disease in humans. Who is at risk? Females are much more likely to be affected by osteoporosis than males. Of the estimated 10 million Americans with osteoporosis, more than 8 million, or 80%, are female. Younger females can be affected by the disease, but osteoporosis mainly affects 1 in 4 females aged 65 or older. Risk factors for osteoporosis are listed on this slide, as you can see. I'd like to note that specific ethnicities are associated with this disease. 1 in 4 Mexican American females and about 1 in 6 white females over 50 years old have osteoporosis. Asian American females also have a higher risk for osteoporosis because they are usually smaller and thinner than other females and therefore may have less bone density. As well as ethnicity, certain comorbidities can increase one's risk also. Diabetes, inflammatory bowel disease, or depression. What are the symptoms of osteoporosis? Unfortunately, most patients don't even realize they are at risk or have the osteoporosis until they experience a fracture. This is why osteoporosis is sometimes referred to as the silent killer. Specific sites for high fracture risk are the wrist. Most people tend to try and catch themselves with their hands if they fall, the hip, and the spine. Once a fracture occurs at one of these sites, quality of life and performing normal daily activities can be severely impacted.
Before understanding how to prevent osteoporosis and some lifestyle modifications, we need to talk more about the screening and monitoring for it. A DEXA scan, also known as dual energy X-ray absorptiometry, is a bone scan that is used to determine how dense or how strong someone's bones are. It can be spelled DEXA or in some literature DXA. Again, these are the same scan. The bone density scans are often used to diagnose or assess the risk of someone to produce or to eventually have osteoporosis, and it is relatively low risk and non-invasive. Before we move forward, it's important to understand who should receive a DEXA scan. First, we'll talk about age. In females, starting at 65 years old, and in males, starting at 70 years old, it is important for all of these individuals to receive a DEXA scan. In relation to family history, if one or more family members have had osteoporosis, or you or the patient personally has had more than one fracture, this is an indication for a DEXA scan. It is also shown that getting a DEXA scan, if having previous fractures, can prevent further injury. If a patient's taking medications like prednisone, cancer medications, or drugs that are used after an organ transplant, which can weaken your bones, it is also indicated for a DEXA scan. Conditions such as rheumatoid arthritis, lupus, diabetes, liver and kidney disease would also indicate a patient to get a DEXA scan. These three categories are included to demonstrate how, after evaluating a DEXA scan result, can be used to evaluate the risk of osteoporosis. Low risk means that the patient would receive lifestyle changes and vitamin supplementation to strengthen the bones. Moderate risk would include vitamins and that lifestyle change, along with pharmacologic treatment. And in that high risk category, we would definitely be giving a more aggressive pharmacologic treatment. Low risk patients, moderate, and high risk will all be receiving lifestyle modifications and vitamin supplementation. Moving to our final section, Angela and I will talk about lifestyle changes, specifically in exercise and diet. The following lifestyle changes are important in the prevention and treatment of postmenopausal osteoporosis. Some of the lifestyle modifications I would like to highlight are as follows. The first being physical therapy and the importance of this in the patients who have experienced fractures, and it can help prevent further fractures by strengthening the muscles to prevent injury and break. I'd like to then move on to smoking. Smoking cessation is important in patients who are at high risk of osteoporosis because it can increase the risk of brittle bones, leading to more fractures. Also, decreasing or quitting alcohol intake is also beneficial for patients who are at risk of osteoporosis or who may become at risk, because this will prevent becoming a fall hazard, which can lead to a potential break or fracture. I will get into the vitamin supplementation on the next following slides, and Ange will discuss exercise in a later section. As pharmacy students, we felt it was important to bring your attention to the medications that can be used to treat osteoporosis. The top two are the mainstay first-line options, being alendronate and risedronate, and they're taken once weekly and come in small unit dose packaging, which makes it easier for storage and adherence. The other two medications are less often used, but can be used in certain patient populations where there are contraindications to be using the first two.
Regular exercise is a major lifestyle modification to prevent osteoporosis. The American Heart Association, or AHA, recommends that adults engage in at least 150 minutes per week of moderate intensity activity, 75 minutes per week of vigorous aerobic activity, or a combination of both. Some examples of moderate intensity activity include brisk walking and gardening. Examples of vigorous activities include running and swimming. The AHA recommends that these activities are spread throughout the week and that muscle strengthening exercises are incorporated at least 2 days a week. It is also recommended in general to decrease sitting time. While the AHA recommends these particular amounts and types of physical activity, they also strongly emphasize that any physical activity is better than no physical activity. As a disclaimer, these are general recommendations from a heart health perspective, not bone health, so please do speak to a healthcare professional for any specific concerns.
Lifestyle changes now are key in preventing and managing osteoporosis. Ensuring recommended calcium and vitamin D consumption, coupled with exercise and limiting risk factors, are critical. I'll get more into the sources of vitamin D and calcium on the subsequent slides. On this slide, I'd like to highlight the healthy amount of sun, ensuring to make sure to use UV or sun protection in SPF 15 or greater. I'd also like to point out the limitation of caffeinated drinks, especially among college students. We need to allow for proper calcium absorption to prevent the breaks and the risk of osteoporosis. Maintaining calcium levels around what is noted on the screen will reduce the risk of osteoporosis and potential bone fractures. Women are encouraged to stay within 1,000 to 1,200 milligrams daily with respect to their age. Men are similar, however, the age is 70 instead of 50. I included males in this chart to be inclusive and holistic, even though our presentation is specifically tailored to women and osteoporosis. These are a few of the best ways to get your daily calcium levels. Milk and yogurt, along with cheese, are some of the dairy products containing calcium. For those with lactose intolerance, eating high amounts of green vegetables and drinking fortified juices or non-dairy milk alternatives like almond milk are options. If consuming calcium through supplementation, you should take it twice a day to increase its absorption. Vitamin D typically comes from the sun, but may also be supplemented. Using in conjunction with calcium, it is important for healthy bones. Men and women younger than 50 need 400 to 800 IU or international units daily. If older than 50, the patient will need 800 to 1,000 IU of vitamin D daily. Moving on to vitamin D, some sources are food, sunlight, and supplements. Being in the sun still requires you to wear sunscreen, as I stated before, to prevent burning and minimizing skin cancer risk. Foods such as salmon and tuna are rich in vitamin D. Although this is not enough to get majority of patients to the recommended level of vitamin D daily. With that being said, men over 70 and women over 50 usually require supplements in this category.
To finally wrap up our presentation, what's the link between osteoporosis and menopause? Generally, there are 3 factors to consider. There is an imbalance in the body's bone remodeling process during menopause and older age. Removing bone takes a higher priority than creating new bone. After menopause, women tend to have decreased levels of estrogen, which is a hormone that helps prevent bone loss. As a side note, this is why men are less likely to be affected. Testosterone can actually be converted to estrogen. Estrogen, calcium, and vitamin D are closely interrelated. Decreased levels of vitamin D can lower estrogen levels, and both estrogen and vitamin D can help the body better absorb calcium. Both calcium and vitamin D are critically important for maintaining bone health. Here is our team. All three of us are in UConn School of Pharmacy in our second professional year. If you have any questions, please feel free to contact us using the emails in the slide. We look forward to chatting with you. Here are our references if you'd like to dig a little bit deeper into any of the topics mentioned.
A shout out to Dr. Marissa Salvo for reviewing the materials for this video. And of course, thank you so much for listening to our presentation. We hope you found it helpful and hope you have a great day.